beauties. My name is Dr. Stefani Kappel and I'm a board-certified fellowship-trained cosmetic dermatologist in Newport Beach, California. And today I'm going to do a video to break down the difference between lasers, energy-based devices, microneedling with or without RF, and microcoring, because I feel that there's so much overwhelming information online when you guys are trying to decide what treatment is good or what treatment is better than another or what treatment would be better suited for you. And I feel like it can be a daunting task, and not only is there a lot of misinformation out there and kind of false advertising for marketing, and people spinning things one way or another, or maybe just people posting who don't really even know any better and kind of propagating misinformation, or there's just such an abundance of information, it just makes it impossible to find a treatment that may be best for you. So hopefully after watching this video, it'll give you a little peace of mind and will allow you as a consumer or a patient to make an informed decision on what treatment would be worth investing in for yourself and for your skin. So the house is quiet. I just got my two little ones to bed. Justin's playing basketball. The dog is outside. So I feel that I'm like hiding in my little corner of the house that's like the only quiet place where I can just hang out with you, break things down, and answer questions that I get typically in my office every day. Even today in my office, I had numerous patients who were first-time consults, and they were asking me like, just tell me what I need, because there's so many things that you can think you need and will sound good online, and the information can be overwhelming, that it's like people are asking me, so are lasers tightening devices, or is Thermaja laser, or is Fraxel microneedling, or is Ellacor surgery? So it's just, there's so many different things. I can tell people are confused, and I don't blame them because there's a lot out there. And being, a board certified fellowship trained dermatologist, I've gone the traditional path. Like, I've loved cosmetic dermatology and laser since I was 17 years old. I knew I wanted to be a doctor when I was 8 years old. I had a lot of doctors in my family, and I pursued medicine, and I knew my first day of medical school that I wanted to be a dermatologist. I was sneaking out of the lecture hall and going to go to the laser lab to learn as much about lasers from the derm residents as I could get my hands on. So I was a sponge for it. And that was when I was, a 22-year-old medical student. So I'm 45 now. I've been doing this a long time, before it was even a thing and before it was so popular. So I feel like I have the benefit of just a lot of expertise and education on my side. The thing with aesthetics nowadays, and I've mentioned this in videos before, doing cosmetic dermatology or aesthetics, there's a gray area, because you're kind of in the beauty industry, but you're still a doctor, or those of us who are MDs, we're still physicians, and we have one foot in the medical community, one foot in the beauty industry, and there's a big gray area. And I've mentioned this before, if you are any other kind of doctor in a hospital, say you're a cardiothoracic surgeon performing open heart surgery, in order to perform that surgery, you have to provide the hospital with your credentials, proof of your residency, proof of your board certification, proof of your fellowship training if you have it, and advanced, areas of your specialty, in order to have hospital privileges to perform these surgeries in a hospital, which is a very regulated, very strict, accountable program. And so as dermatologists, we're in the same arena as people who may be estheticians or nurse practitioners, whereas no knockoff to them, that's totally fine, but they may have not gone the path of years of really studying the skin, years of really studying histology and pharmacokinetics and physiology, and how certain lasers or devices or energy-based devices or treatments or even active ingredients affect the skin to a cellular level, to where every kilodalton of every protein in the skin. Like a dermatologist, there's no one who can compare to the knowledge that we have. So hopefully, sharing this information, if you follow me as either a patient or a newer injector, or somebody who's getting into the aesthetic space or wanting to practice dermatology, but you didn't go that traditional route. I mean, let's be honest, there's not many of us out there, who are experts in this field, because it's such a very small group of people who are actually board certified dermatologists. And I feel like it's almost like my duty to protect people and enlighten people and educate people, because there's a lot of people crossing over into the aesthetic space who didn't take that road to get there, right? I mean, say that they went to school for 6 months, or they YouTubed really quick how to inject Botox, or YouTubed really quick how to do a laser, and they're not going to disclose that to patients, but they're doing these procedures and on cash paying patients, and these terrible complications are happening or results are suboptimal, and then they get referred to me or people like me or colleagues of mine to reverse complications or to manage things that have gone wrong or to give treatments to patients who have had suboptimal outcomes from other treatments that didn't work very well. But it's not anything negative, and it's not saying anything bad about some who are, I'm not even going to say less trained, but maybe somebody who wasn't trained in this, in this field for 20 years, 15 years, who are maybe practicing another area of medicine, who crossed over and don't have that expertise. And that's fine. I think it's great that they're seeing patients, and I feel like it's a good thing that there's so many aesthetic procedures that are available, and they're very available to almost everyone now. But at the cost of maybe having less than ideal providers providing them, which can cause harm or can be the wrong selection of treatments, or also, say somebody owns a med-spa. Say you're an OBGYN who's like, you know what, I went through medical school, I'm practicing OBGYN, I don't like this anymore. Aesthetics is more lucrative. Let's just be honest, it's a more lucrative field. And I'm just gonna open a med-spa and get a bunch of extenders. I'm gonna buy a few lasers and treat patients. These are the areas where it's set up for bad things happening. And that's not to say you have to go to like a fellowship trained, board certified dermatologist for your Botox. I'm not saying that at all. But when it comes to picking a laser, having complications by somebody who may not even be aware of the ramifications of doing, a really high, percentage TCA peel and burning someone. I mean, I can't even tell you how many times I see burns, chemical burns from peels that were done by estheticians. Again, nothing against estheticians. Some of my best friends are estheticians, and I work closely and hand in hand with estheticians all the time. But sometimes they'll perform treatments, and they'll have these complications, and they don't know any better, so it's not actually maybe their fault, because who would know that a 40% TCA would burn the periorbital skin or cause hyperpigmentation. But what I'm saying is there's so much accessibility for people to do certain procedures in aesthetics and cosmetic dermatology where there's a lot of risk involved, and unless you know what you don't know. And so hopefully after watching this video, you'll kind of understand the difference between what is a laser, what is an energy-based device, what is microcoring, what is microneedling, and what are the other options, and why am I seeing posts on people having their fat melted from energy-based devices or radio frequency, and why am I seeing all this post-inflammatory hyperpigmentation and scarring from lasers, and why am I seeing all these dropped brows from Botox? It shouldn't be that way. That shouldn't ever happen. And the reason why it happens is because there's no accountability for people doing these procedures in these med-spas, because they're not hospitals, and there's no hospital privileges or accountability or boards that you have to take in order to inject Botox or doing lasers. I mean, honestly, it's like the Wild West out there. Anybody can do it. And that's fine. I think that's great that it's available to everyone, but it's just, you have to go to somebody who knows what they're doing and didn't take some crash course and pick the wrong treatment for you. So I'll kind of break down. I just kind of broke it down. I just kind of said a lot, but I just think that the purpose of this video is to do no harm, to spread good in the world. And again, my content is non-sponsored. I could speak freely and with authenticity and honesty based on years of education and really having an understanding of the skin and treatments available in aesthetics in today's world. So what is the difference between a laser, an energy-based device, microneedling, and now we have microcoring, which is Ellacor, and it's a whole new revolutionary technology that's in its own space. It's not a laser, it's not an energy-based device, it's not microneedling, but I'll kind of break it down for you. So laser just stands for light amplification by stimulation of the emission of radiation, and that is basically a device that uses photons, which is a form of energy, in a collimated wavelength that is attracted to a certain chromophore. So in English, what that means is there's specific photons that are in a coherent wavelength, a wavelength that targets something specific. Now that could be melanin for like melasma or hyperpigmentation or brown spots. That could be a hair follicle, because the melanin in a hair follicle is different than melanin in the skin. That's why with laser hair removal, you have to have a specific wavelength that's going to target a hair, but not going to depigment the skin, especially in darker skin tones and skin of color. Especially with laser hair removal, you have to be really careful with the selection of what wavelength you're using when you're treating a skin type 3, 4, 5, 6 for hair removal. Or, the wavelength can be attracted to hemoglobin, which is redness, which is how V-beam, KTP, XLV, 532 to 595 nanometers of wavelength, it will target the redness. Or you'll have a laser that targets water, and that's how we eliminate fine lines and wrinkles and stimulate collagen, like a Fraxel or like an erbium or a CO2. So there's different lasers that are attracted to different things, and I'm going to break it down in scientific terms because you guys are smarties. If you're following me, I know you get it, and I know if something doesn't make sense, you can drop a comment in the comment sections or Google it. But there's something called the theory of selective photothermolysis, and that means lasers are specific to do certain things. So a V-beam V-beam will target redness. A pico laser will target brown spots. A YAG laser will target, hair for hair removal. A CO2 or an erbium or Fraxel will target water, which will help with fine lines and wrinkles, shrinking pore size, and textural irregularities. So different wavelengths, lasers are like golf clubs. You take a different golf club to do a different job, right? And so when I see patients in my office and say they have a little bit of redness, they'll have some brown spots, they have some fine lines or wrinkles, it's really amazing to be able to customize a treatment and to do pico for the brown spots, V-beam for the redness, and then Fraxel the whole face to get the collagen stimulated, pores to shrink down, and to help with the texture and tone of the skin. So it's lasers are very specific treatments for skin rejuvenation, and it's called resurfacing because it's very superficial. It's in the stratum corneum, the very top layer, most superficial portion of the epidermis, the upper portion of the skin. That's where lasers are. They're at the very, very most superficial top portion of the skin. Versus energy-based devices, which we'll talk about later, are deeper. So they tighten skin. They stimulate collagen deeper, but they're not going to get rid of the brown spots, the redness. They can't be used for laser hair removal, so things of that nature. So hopefully that makes sense. But I really love doing lasers and combining lasers because it fixes the problem at a cellular level. So say somebody has dark circles under the eyes, or they have hyperpigmentation patches. You don't have to rely on makeup or cover up to cover it up. You can treat it with a laser and then be able to go makeup free. I never wear makeup. Of course, I wear makeup around my eyes. I have my eyebrows microbladed. I always have lip gloss on. But for my skin, I don't have any makeup on my skin, and I never do. I have sunscreen, but that's all you need, because when you correct things from within with lasers, you can go around with healthy, beautiful skin without having to cover up anything. And so that's the goal, and that's why lasers are so cool. On that note, why don't you see lasers everywhere? Why do you see things like IPL, broadband light? The reason why, now I did a fellowship in an amazing laser institute, which was, I had like hundreds of lasers in a 2-story building with like 30 rooms with all these different devices and lasers in it. And there was a IPL and broadband light, all those lasers were in one room, and that room was like, there was dust and cobwebs. Nobody ever used that room because IPL and broadband light, in my opinion, and also according to a world-renowned expert who trained me, they're not as elegant as lasers. You slap on a filter and it's broadband light. It's not one collimated wavelength. It's kind of like just this broadband light that you try to make it act like a laser, but it's like a cheap version of a laser, but it's easier to use. They're a dime a dozen. They're on every street corner. It's like having, a Toyota or having like a jet. You got to get a pilot to fly the jet, but the jet's going to be a lot faster and much more efficient and more amazing than the regular everyday car, but almost everybody could drive a car. Not everybody can drive the jet, so you need to get a pilot in order to operate that machinery correctly. So that's why you don't see picos and Fraxels and CO2s and erbiums in medi spas. You see IPL, you see broadband light, they're drop-down menus. It's kind of jack of all trades, master of none. Usually they're a little bit more hesitant, so they kind of undertreat, or they go the other way, they're overzealous and they scar people. So, and I hate to be jaded, but I see complications from outside practices all the time. I'm in Orange County, and there's a lot of this stuff going on, and they come to me to reverse these things. So I feel like increasing awareness by doing videos like this will kind of prevent people from having complications happening to them. So not that I'm not a fan of BBL or IPL, it's just not my favorite, especially when you're comparing it to the elegance and specificity of a laser, because nothing can compare it. It's harder to get someone who understands how to work a laser than an IPL, which is why you see more of them, because you have to have certain settings, certain wavelengths, the fluence, the spot size, the pulse width. this is technical terms that among dermatologists and especially fellowship trained laser specialists, this is how we talk. But most people, especially if you're in a med spa with an extender, is not going to know, how many joules per centimeter squared or what pulse width or spot size to use on each individual patient depending on their individual skin type. So that's why you'll see IPL and BBL everywhere and not so much lasers, but lasers are the way to go if you can find someone who understands lasers and can operate them safely and effectively. Okay, next moving on to energy-based devices. Now, what is an energy-based device and how is that different from a laser? So remember, we said lasers are collimated light. They're photons, incoherent wavelengths that are good at specific jobs. And there are lasers that are kind of good at everything, like Fraxel does everything. Fine lines, wrinkles, brown spots, reverses sun damage, kind of a little bit of everything, but it's still very specific because it's a specific wavelength. Energy-based devices don't use light or photons, they use energy, and that energy could be ultrasound, microfocused ultrasound, monopolar or bipolar radio frequency. It could be microwave. There's different forms of energy, but putting energy into the skin stimulates collagen. And an extreme case, an example of how that works is if you ever see a burn scar, like a burn victim, what happens in the areas that get burned when there's heat put into the skin, the fibroblasts, which are the collagen producing cells, make a lot of collagen, and they make these very keloidal plaque-like smooth, firm, disfiguring scars. But if you look under the microscope, it's chock full of thick pink collagen under the microscope, and that's what scars are made from. So when you put heat in a very controlled manner, you keep the upper level of the skin cool and you heat the deeper portion of the skin, it signals those fibroblasts to make collagen a very controlled, it's almost like a wound healing situation. So that's why sometimes plastic surgeons will say, you're inducing scar tissue, and if you have thermage or oral therapy, you can't have surgery. And that's absolutely not true. Either the plastic surgeons are misinformed, and let's be honest, they spend 8 years in the OR, the skin is not their domain. I know they like to cross over into our lane and do, lasers and different things that involve the skin. And again, I have to reverse a lot of those complications too. I just had to do one today. From a plastic, so I actually referred to, and anyway, so what happens is you do have some collagen synthesis, but it's not a scar that would inhibit you from having a facelift or a neck lift, especially when doing things like thermage or oral therapy. And I can speak as a dermatologic surgeon because I did a Mohs micrographic surgical fellowship where I was doing flaps and grafts and transposition flaps and making people new ears and noses after we excised skin cancer and tumors. And this is in patient populations who have aesthetic and cosmetic procedures done. I've never had a problem operating or doing surgery on somebody who's had repeated energy-based device treatments or lasers for that matter. So I can speak from both hands. But the mechanism of action in the way these energy-based devices work is it induces collagen synthesis, and so we use that to our advantage. And the people who engineer these and come up with the technologies are brilliant because what they do is they induce the skin to synthesize more collagen, and that lifts, tightens, and pulls, snatches areas like the lower face, around the eyes. I've had thermage myself 3 times in my life. I'm 45, I'm gonna be 46 next month. And I had it when I was 30, I had it when I was 35, and I had it when I was 40, and I'm overdue. I probably need to do it again. But I feel like it's kept, my lower face area pretty snatched for a longer period of time. And the results from these energy-based devices usually last, anywhere from 3 to 6 years, which is really great. And you're inducing your body's own regenerative processes that gives the most natural looking results. Because if you're trying to lift and tighten and pull this area by doing a bunch of filler, I do thread lifts too, or thread lifts, the results aren't as long lasting because it's not inherent. You're inducing your skin to do the work, which makes the results more natural and longer lasting always. The half-life of collagen that gets synthesized by these energy-based devices usually lasts about 3 to 6 years. Everyone's different. And even in my more mature beauties, we can still induce collagen production in them. Maybe not as easily as we can in a 30 or 40-year-old who's doing it for more collagen banking, so they have increased collagen stores. So as we lose 10% of collagen each decade, they're staying, in one place or staying ahead of the game. But still, in my more mature beauties who are in their 6th and 7th decades of life, we can absolutely restore and synthesize collagen to have those same effects. So it's one of my favorite things to do, and energy-based devices differ by the amount of energy or the heat that's put into the skin is coming from a different source. For soft wave and ultherapy, it's ultrasound. For thermage, it's radio frequency. And for some of the others, I mean, there's so many different, there's face tight, there's thermi, there's so many other different, well, thermi is not really a thing anymore, but there's been in and out all these new shiny toys on the market, and the method in which they work is by putting heat into the skin, and the type of energy that is used to put that heat in the skin can differ, and that's the difference between ultherapy, thermage, soft wave, and so forth. So between all of those, my favorite is thermage, but a lot of my colleagues who are well-esteemed, established cosmetic dermatologists love soft wave. They still like ultherapy. I just, from personal experience, you're always a product of your experiences. And when I was in that laser center with all the devices, I was like a kid in a candy store, and I just used them all. And I saw what patients were happiest and who had the best results from. And I was there for about 4 or 5 years. And the people who had thermage always were the happiest, had only one treatment needed, and had the most reproducible, predictable, beautiful results. And ultherapy works okay, but it was painful for a lot of my patients. They always required more than one treatment. Some of them will be like, I don't know if it made a difference. And I'm like, okay, then that device is out. But a lot of my colleagues like it, and I do think soft wave and ultherapy do work for certain people, but it's not as slam dunk as thermage is for me in my practice. Now, the way I do thermage in my office, and my colleague who's also a board certified dermatologist, there's a specific way that we do it, and we're very risk averse, and you don't have to worry about melting fat. You don't have to worry about any of those deleterious side effects that maybe somebody could be at risk for if you go to in the hands of an unskilled operator. First of all, people who numb you for that, the numbing should never be an issue. You need that biofeedback from the patients to say, okay, it's too hot, turn it down. If you just knock the patient out or numb them, or God forbid, plastic surgeons have their patients out with general anesthesia and they're doing these procedures on them, that's not the way to go, because you have a certain range, a certain window that you have to be in to stimulate collagen and get the results you want. But if you're above that, then you're in fat melting territory. And if you're below that, your treatments are going to be so suboptimal, it's not even going to make a difference. So understanding those windows and how to heat stack, how to put your vectors, there's so much that goes into it that really can make a difference. And that's why you may see variable reviews when you're looking at something like thermage. Like, some people say, I had it and it didn't work. Chances are they didn't go to a highly trained operator, somebody who really knew how to work the device. So you always have to take that into consideration as well. So to be fair, I want to include microneedling in this video because it's one of those devices that's going to come up if you're doing a search for rejuvenation or treatments. It's going to come up, and I feel like I want to be all inclusive. And again, I'm non-sponsored, so I can speak freely. And this is just my opinion based on experience. Microneedling is kind of like jack of all trades, master of none. You'll find them a dime a dozen on every street corner. Every med spa is going to have a microneedling device because it doesn't really take a high level of skill to operate it. There's just a few settings. It's not as complex as an energy-based device or a laser. But the problem is that it's expensive, it can be painful, and patients are always unhappy. I would say 95% of patients are unhappy with it. I've had every microneedling device in offices that I've worked in my fellowship and even after, and patients were repeatedly unhappy, would have to get rid of the device. And why would we use the microneedling when we have lasers or energy-based devices, which are so much better? It's harder to find people who can operate those devices, but once you do, there's no comparison. Microneedling can cause some transient inflammation that can make things like acne scars or fine lines and wrinkles look better, but when you look at a patient 6 months later or 1 year later, they don't usually look better. They look the same. And with lasers and other different devices, you're supposed to look better about a year later, and definitely 6 months later. So that's the reason why I'm not a big fan. But for some people, there are people out there who have responded to it well. So I want to include it, to be fair, in this video. It's not my favorite, but again, I do want to I have an obligation to be all inclusive and all-encompassing of all devices that are going to pop up on your feed when you're doing these searches for different treatments, but it's not my favorite, and that's why. Also, like I said before, you're a product of your experiences, and if I'm getting inundated with these people having complications from microneedling, I'm not going to be a big fan of it, because all I see is hyperpigmentation, scarring, infection, unhappy patients, people who didn't see a difference after spending a lot of money and having really painful treatment. So that's just my 2 cents. But I would say if microneedling comes up, run the other way. Or if you are down to try it and you're not you're a fair complected patient and you're not going to be at risk for hyperpigmentation, because that is a true side effect of it. You won't see that published a lot, but I see it all the time. and that's the problem. I think I would probably stay away from it, and I would definitely go more for either investing your money into even just skincare products that are smarter and engineered a little bit more elegantly, or a light, clear, and brilliant laser, or even just like a facial. So microneedling, I'm not a big advocate of it, but I wanted to include it because it can be used for fine lines, wrinkles, and acne scars. I just don't think very well. Okay, and then microcoring, which is Ellacor, which I've done a couple of videos on before. Microcoring is this new technology in this new category of its own. It's not a laser, not an energy-based device. It's not microneedling, but it's microcoring. And Ellacor is the first of its kind, and what Ellacor is it's almost like microneedling, but instead of having little needles that just basically poke holes into the skin, it's hollow needles that take little cores of skin out. So little pieces of skin that when you combine them all together makes up about 10% of the skin being excised in a scarless fashion. Now, the downside of Ellacor, and please watch my other videos because I don't want to dwell on Ellacor in this video, but it can cause some post-inflammatory erythema and even hyperpigmentation, even in skin types 1 through 4, which is FDA approved for. We can reverse these with different lasers or combination lasers with hydroquinone or other brightening agents, no problem. And we've been rolling this out really slowly in my practice, but I've treated several patients now who have had great responses already, and it's still very early. And in the clinical trials, the results were amazing. So I'll do whole other videos on Ellacor, so I don't want to belabor that, but I wanted to include microcoring in this video because, like microneedling, when you do these searches for rejuvenation, it's going to come up. So I think that those are the 4 main categories: lasers, energy-based devices, microneedling, and microcoring. And the other thing I forgot to mention with microneedling is you can have the microneedling with or without radiofrequency. And so radiofrequency, just like thermage, will induce the fibroblasts, the collagen-producing cells, to synthesize collagen. And they all differ with respect to the types of microneedlings and the radiofrequency that's distributed underneath the skin. Some go deeper than others. Some can be used, on the body with success, I think. So I haven't really seen that yet, and it hasn't really been presented at many of our academic meetings. But the radiofrequency component of microneedling can promote collagen synthesis, but at the same note, it's heat and it's energy, so it can also cause post-inflammatory hyperpigmentation, and there is a risk of possible fat atrophy, so just beware. So hopefully after watching this video, you'll kind of understand the difference. Again, light lasers are light, they're photons, it's more superficial, more targeted for like the upper portion of the skin. That's why it's called resurfacing. It's resurfacing the skin or treating different things from the outside, like brown spots, redness, broken blood vessels, hair removal, tattoo removal, and so forth. Energy-based devices, if this is the top layer of the skin, are deeper, and those are just to tighten. And it's just by induction of collagen synthesis and stimulating your body's own regenerative processes and pathways to do so. Doesn't do anything. It won't. An energy-based device won't do anything for brown spots or sun damage. It will just tighten skin underneath. Microneedling, not my favorite. Pokes thousands of tiny little holes and just doesn't, it can, in theory, make scarring and fine lines and wrinkles and rejuvenation better. I say maybe for younger beauties who aren't really at risk and, for hyperpigmentation, and you won't be too sad if it doesn't really do much. I think maybe those are more, they're a better candidate for microneedling. Microcoring is better for my more mature beauties who have more laxity and really need a more substantial outcome. But it's the flip side, or the caveat to that, is that there's more discomfort and downtime in the week after treatment. And the discomfort actually during the treatment is negligible because we usually use local anesthetic. And after the treatment, it's painful to look in the mirror because you have these, swelling and bruising and redness, but it doesn't hurt at all. The pain's not bad at all. And then that's pretty much it. So I hopefully this will kind of break it down and help you understand what treatment may be best for you. If you're darker skin tone, you can break it down with lasers as to what laser would be right for you or not right for you, and that all just comes by going to a well-versed laser specialist. Always look for ACGME, a fellowship-trained laser specialist. That's the way to go. I don't want to hurt anybody else's business who doesn't have that, but if you really are risk-averse and you really want to do the right thing and look for somebody highly trained, you probably will have to travel to find someone in your area. If you live somewhere, outside of, New York, California, Miami. It may be harder to find somebody, but it's definitely worth it, especially for your first time. Maybe get that provider's laser settings, and then maybe you can reproduce that with somebody who maybe is a little bit less highly trained. So hopefully this helps you guys. If I can help anybody out there, I hope I did. Again, non-sponsored content. This is why I do this whole YouTube channel. I love hanging out with you guys and sharing information and hopefully protecting you guys from having less than desirable outcomes or complications. All right, I love you guys. Thank you so much for subscribing and for watching.